how does sleep apnea affect your heart, brain, and overall health? I'm Dr. Manvir Bhatia, a senior neurologist and a sleep specialist, and I will share some insights on these three topics with you. So sleep is just not a rest. We now know that sleep is a vital function for the body. Besides a rest, it's a recharge, it's reinvigorate, and helps you take care of your overall health. And inadequate sleep affects each and every system of the body. So, and now the next thing, what is sleep apnea? The common symptoms of sleep apnea are loud snoring, choking, disturbed night sleep, and feeling sleepy in the day. But in this, we want to go a little beyond this sleepiness in the day and share what else happens in the heart and the brain and the body. So when people experience this sleep apnea, there are these frequent disturbances in breathing, resulting in a drop in oxygen. This is harmful for the heart. It can increase blood pressure, increase your chances of having irregular heartbeats, that's called as arrhythmia, also can cause increased chances of having a heart attack and also heart failure. In fact, leading journals in cardiology have said that besides these risk factors, there's also a risk of sudden death and also heart-related death. So thus, sleep apnea should not really be ignored. Now, coming to the brain, what happens in the brain if we leave sleep apnea untreated? So during the apneic events, there are something called as frequent arousals or breaks in sleep. These activate some systems in your body, disturb the deep sleep component and the REM sleep. So there is impairment in concentration, focus. There are mood changes leading to anxiety, depression, and overall decrease in productivity. In fact, it's even more dangerous in children. It affects not only their learning, but also behavior and their growth. And again, there is enough adequate research showing that sleep apnea can double the risk of having a stroke and also things like dementia and Alzheimer's. Other systems in the body, overall sleep is important to maintain blood sugar and body weight. And patients with sleep apnea are more likely to have prediabetes, diabetes, or worsening of their diabetes control, and also worsening of their immunity, difficulty in managing their weight. So keeping all these in mind, we know that untreated sleep apnea is very, very harmful for the whole body and all your overall health. But the good news, so sleep apnea is treatable and can be treated to make you feel better and reverse these side effects of this untreated condition. So initially, but to get treated, you have to get diagnosed. So for diagnosis, we have a test which is called as a sleep study, in which sometimes you have to visit the hospital or the center and get some sensors placed where the overnight is recorded. But we do have now, with the advances in technology, something very simple, easily done at your home, but yet accurate. And this is a US FDA approved device called as the balloon ring, which if you use it at night, maybe for one night, 2 nights, or also can be done for multiple nights, which can tell us the oxygen through the night, can tell us about your sleep, can tell us about the apneic events. So this is a step forward to enable an easy diagnosis so that this condition, which remains undiagnosed in 80%, can be treated. So take charge. Do not let sleep or poor sleep or sleep apnea, let's say, steal away your health. And we can help you in this. More details you can find on our website, neurologysleepcenter.com.